Good afternoon. My name is Dr. Muhammad Wajid Chaudhary. I'm one of the pediatric specialists. So today's topic is urinary tract infection or urine infection in children. So I'll be talking about what it is in layman terms and what to do if you think of urine infection. So basically, urine infection is when some bacteria starts multiplying in the kid's waterworks and that give rise to symptoms. It depends on the age group of the children for the symptoms. So if the child is verbalizing and can tell the problems, they will generally tell about some irritation while passing urine. They may also have a fever, and some kids start vomiting when they have a high fever. If it is a small child which is not yet speaking, then they might just have a bit of irritability or a fever with no apparent reason, including no cough, no cold, and no diarrhea or other symptoms. And so, this is the time the parent should think of urine infection as one of the possibilities and should seek medical advice. It is very important to get to know if there is infection or not, and if it is, then it should be treated promptly and uh, 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 appropriately. So, when you go to the doctor, what the doctor generally does is they will do, he or she will request a urine test which has two parts. One is called urine routine, where they can look at the in the microscope to see if there is any bacteria or any evidence of an infection in the urine. Second one, which takes a bit longer, around 48 hours time, is called urine culture, where the urine is kept in laboratory to see if some bacteria or bug is growing, and if it is growing, then it will also tell what is the bug, the name, and what is the best medicine that will be working against those bugs, and that should be given. So once it is done and the diagnosis of urine infection is made, then most of the kids can be managed at home by medicine by mouth. Only occasionally, the patient might need to be admitted or hospitalized for initial few days for the treatment. And the reasons for hospitalization is mainly either the child is too unwell, or uh, there is infection with a bacteria or a bug for which there is no medicine available by mouth and only injections work, or the child is just vomiting a lot and is not keeping any medicine down. So, if the child do get admitted, it will take a couple of days before they are well enough to go home and complete the course of antibiotics. What do we do after the patient has been clearly treated for the urine infection? So, what we need to do is we need to keep in mind that some kids do get a urine infection a second time, and so they should be um, basically monitored for that. If your child gets a fever again with no other symptoms, then they should be seen by a doctor within 24 hours, so that if your doctor thinks that it could be a possible urine infection again, they will do repeat urine testing, and that will clarify. Why it is important? Because if we don't treat the urine infections correctly, appropriately, and early, then there are long term complications. Thank you so much.